A very good evening to everyone, and thank you specifically to the chairperson. So, hello once again, everyone. Our title is The Development of a Dysphagia Diet Manual in Bahasa Melayu, and I am presenting on behalf of my team that consists of Muhammad Azmarul Aziz and Emily Kok. So, obviously, many factors influence healthy aging, but many are actually within our reach, such as healthy eating. So eating and drinking itself can sometimes pose difficulties for the elderly. This difficulty, known as dysphagia, occurs as a result of any disruption to the safe and efficient transfer of food and fluids from the mouth through the pharynx and the esophagus and into the stomach. So for example, if a very mild form of dysphagia would occur when an individual has some difficulty to chew and swallow food efficiently due to missing dentition. But the most severe forms of dysphagia could actually affect the individual at various levels. So, and this increases the risk of something called aspiration pneumonia. So, as you can see here, the consequences of dysphagia are indeed multifaceted, and we don't really want to get into severe consequences. We leave that to the speech therapist to describe or to explain to the patients, all right? So the healthcare professional who actually manages dysphagia is the speech language therapist, or SLT. So SLTs frequently prescribe texture modification to clients or to patients as part of their dysphagia diet. Okay, so this is the first level of management. So this usually means that foods and fluids are modified. Foods are usually moistened or pureed, and fluids, on the other hand, are thickened to specific guidelines and specific textures or consistencies, right? So when this modification actually happens, as you can see in these two images below, all foods taste, look, and feel the same way. So just imagine having to eat something that looks like this for every single meal. So this is where non-compliance occurs. Yeah, quite frequently with patients, you find a lot of non-compliance. So as you can see the statistics from a study conducted by my colleague Azmarul at Hospital Rehab Cheras in 2017, there has been quite a bit of non-compliance with this modified diet. So their findings at that time were fairly similar, or quite similar actually, with a more recent study by Chadwick in 2021, which found that compliance was actually directly related to the levels of training and guidance provided to the caregiver of these individuals. So as most literature is based on Western foods and ingredients, Malaysian SLTs, on the other hand, simply provided notes and verbal instructions on how to modify food textures and what is or isn't safe for this individual to eat or drink. Yeah. So the information can occasionally become rather vague and is not really very standardized. So the objective of this study was very simple, or is very simple, to develop a dysphagia diet manual in Bahasa Melayu for caregivers and dysphagics, tailored to the local culture and palate. This manual was developed following the systematic steps of the ADDI model. Yeah. So for analysis of what was needed to be included in the manual, focus group discussions were held with SLTs who worked closely with dysphagics and their caregivers. This was done to identify the needs and challenges faced when preparing a textured modified diet and the relevant contents to be included in the manual. So we needed to really know what needed to be included in the manual. So based on this, we designed and developed the manual and allowed 8 caregivers to trial the manual for a period of 2 weeks. and also 3 SLTs to give us some feedback. The use questionnaire by Arnold et al. Was used to assess usefulness, ease of use, user satisfaction, and ease of learning of the manual, which was actually scored on a 7-point Likert scale. So these are some of the results. As you can see, this is written in Bahasa Melayu, and the questions were actually validated, translated and validated prior to use. So the results revealed that all participants were satisfied using the manual, found it useful, was an easy to use manual, and it was very easy to learn. So the scale level content validity index for universal agreement across users was 0.923 and averaged at 0.99. So this implies that the user scored 5 or above on a 7-point scale across most of the 26 items of the questionnaire. So in addition, the caregivers felt more confident when preparing the dysphagic diet or the dysphagia diet, and felt that it saved them a lot of time. Several limitations were found, obviously, with the study, as of any study, and these are some of that. So what we failed to do, unfortunately, was to evaluate the caregiver's knowledge of dysphagia prior to data commencement, or data collection, sorry. No evaluation of caregivers' prior knowledge of the importance of the diet modification was assessed, and there was also no prior evaluation of caregivers' prior knowledge of how to modify the diet appropriately. And so to conclude, the preliminary development and the use of the manual were successful, but future research should actually focus on continuing the implementation and evaluation across a greater number of caregivers from varying backgrounds, and to see whether the basic knowledge can be used to expand the dysphagia diet menu appropriately. We don't want individuals to have the same menu repeated over week after week after week. So we want that expansion of the menu to happen. The manual is currently being explored and expanded to include more recipes and include other cuisines as well. And so just to reiterate, the development of the manual in other languages is currently underway, and we are trying to incorporate more images and videos to go along with the manual as well. So these are some of the images from the preliminary manual, and I thank you.